Welcome to Lord and Richards Radio, a program that will enable you to become more financially independent and prosperous from a biblical point of view. Tune in each week to learn how to prosper through good markets and bad. Now, here's our host, Colin Richards, your biblical investment advisor.
Hi, friends. I'm glad to be with you today on Lord and Richards Radio. I'm Colin Richards, founder and president of Lord and Richards. We're a team of advisors who are dedicated to helping people just like you retire financially independent. And we're doing that every single day. On this show, we're discussing investing and planning from the perspective of key biblical principles, a little bit different way of looking at money. We also talk about how to use methods and strategies that will enable you to prosper through both up and down markets. And that's so important in today's volatile world. I'd love to chat with you. My team and I would love to help you, talk to you about your specific questions regarding retirement and saving and investing from a biblical point of view. Just pick up the phone and give us a call at 720-372-0400. Again, that's 720-372-0400. I'd love to chat with you about how you can achieve financial independence from a biblical point of view. Or just check us out on the web at lordandrichards.com. Hey folks, this is Colin Richards, president and founder of Lord and Richards, and once again, I'm excited to be with you on this edition of the Lord and Richards Show. And as you know, if you've listened to our show for any length of time, we talk about topics that are of interest to those who are looking to achieve what I call retirement freedom. That is the idea that whether you choose to work or not, you've got the financial freedom, you've got the time freedom, you've got the health freedom to be able to truly enjoy and experience fulfillment during those precious retirement years. And we've helped literally thousands of people across the country over the years and are excited to be talking to you today. Now, we're in the midst of a series on what I call biblical retirement freedom, how to achieve retirement freedom from a biblically based standpoint. And that simply means we're going to rely on some texts of Scripture to help point us in the right direction. And overriding all of this is the idea that as each of us has received a gift, let's use it to serve one another as good stewards of God's varied grace. That's found in 1 Peter 4:10. And we know that the idea is that everything we have, the Bible says, comes down from God. Every good gift, every perfect gift is from above, from the Father of lights. And you and I are to not only enjoy that, but to use it to serve others. And happiness, fulfillment, joy really comes in retirement as we do those things that rise up higher on that hierarchy of needs. You know, when we get past just safety, security, food, shelter, and we're up at the top and we're looking at things that give us true fulfillment, whether that's investing into the lives of your family, spending more time with them, whether that's giving to causes that are important to you, volunteering at church, volunteering at local community events and organizations, helping those who are less fortunate, or just generally spending time with the ones that you love, doing the things that you love for all the reasons that give you purpose and fulfillment. And the first of those freedoms that are critical for you to have that kind of retirement is freedom of time. And we spent several episodes talking about the critical nature of freedom of time. To get the time you need, you've got to be free from your work, your career, unless that's what's giving you your fulfillment. But even so, we don't want to be financially tied to having to do that until the day we die. And so we need freedom of time to do the things we love. And to replace work or our career, we need abundant income. And we walked through a variety of tools that are available, and you can check out those prior episodes that provide guaranteed abundant income as opposed to simple portfolio withdrawals, dividends, real estate, and so forth that provide potential for income, but it's not guaranteed and it's often not abundant. And so at the end of the day, Lord and Richards, we step in to fill the void. Classic advice, financial advice, centers around one thing, and that's accumulation. And that's fine when we're in our working years and we don't need to depend on the money. When we are in those years where we can set aside the statements no matter what's going on in the world around us and kind of just keep stuffing money into our 401k or our IRA. But when we get near, say within 5-10 years, retirement, we've got to start playing a different ball game. We got to start playing calculus. And what you're going to need beyond just somebody who focuses on accumulation is somebody who focuses on and specializes in distribution. And that's where we fill the void. So Lord and Richards specializes in distribution and income, not just accumulation. You need both in order to have freedom of time in retirement. And now we're moving on to the next layer of freedom. Once we have the time, we're going to need freedom of health. Freedom of health. Somebody has wisely said a healthy person has 1,000 wishes, a sick person just one. And isn't that so true? Excellent health in retirement will enhance your ability to pursue happiness, will enhance your ability to find fulfillment, will enhance the time that you have on hand to enjoy the ones that you love and do the things that you love. So what are we talking about when we say freedom of health? Because you say, Colin, are you a medical professional? I am not. I have those in my family, but I am not a medical doctor. I am not a PA or anything like that. But here's what I am. I have observed thousands of people, both before and after retirement, have their wishes curtailed, their happiness curtailed because of health difficulties. Now, some may be unavoidable, right? We're all in God's hands. And even the great apostle Paul, when he prayed for relief from what he called a thorn in the flesh, God said, look, I'm going to give you the grace to overcome that. My grace is sufficient for you. My strength is perfect in weakness. And you know what? We bear that gladly as followers of Christ. But there are things that we can do that will prevent certain types of illnesses, ailments, and injuries. And so let's first talk about the kinds of health care that are out there and available to us, all right? We all are aware of health insurance, right? That's for acute care. And by that we mean things that happen like injuries, diseases, and so forth that come upon us that our normal health insurance are going to cover. There's also chronic care. These are the things not covered by your normal health insurance. In other words, if you're admitted to a nursing home or if you're at home and can't perform 2 of the 6 activities of daily living, such as feeding yourself and clothing yourself and so on, then we're defined as having a chronic illness, an illness that is continuous, ongoing. Well, our health insurance, and this includes Medicare, will not pay for those kinds of illnesses. So people who receive certain diagnoses are going to have to, after about 90 days, typically of Medicare coverage, you're going to have to fund that out of your pocket. That's a big one, and that's one we want to address. And then there's another kind of care that I don't want to ignore called preventive or proactive care, I like to say, getting ahead of the game. Many diseases that afflict us in old age are preventable, right? It's typical to find that we are on medications as we get older for high blood pressure, blood sugar, on and on it goes, right? Blood pressure. These are things that can often be avoided by taking advantage of preventive or proactive healthcare. And what do I mean? Well, you're going to want to exercise regularly. I talk about this, and I've had entire programs on this. You're going to want to get your body up and moving. Recently, a wonderful lady commented, she said, motion is lotion, right? So not having the stiff bones and joints and so forth, being able to get up and go, right? Not being hindered when your family wants to go up a flight of stairs somewhere. Right? These are all things that you and I can get on the front end of, and I would like to encourage you to do so. 2 wonderful books that I recommend. First of all, Dr. Gabrielle Lyon, she has a podcast. Her specialty was in working with folks with older age. That was her specialty in medical school. And she discovered that one of the great reasons people pass away early or are infirm as we age is because of a lack of muscle. You're losing about 10% once you hit your 30s every decade, about 10% a decade. So it doesn't take long to figure out, wow, I'm going to lose a lot of muscle. Well, guess what? Low muscle is a higher predictor of mortality than even things like obesity. And so we want to get ahead of that. And then another great author on this subject is Tony Robbins. So Tony Robbins has written some tremendous books on this subject and talked about some of the advances in healthcare treatments. He's talked about ways that you and I can get access to things like stem cells for faster recovery. My wife has taken advantage of that for her knees, platelet-rich plasma. Some of these things are covered by healthcare, some are not. And so in our next segment, we're going to talk about the importance of and where to find the money to be preventive and proactive in your healthcare. Well, folks, this is all part of what we call a retirement freedom roadmap. And it's something that every single client of Lord & Richards gets as a part of being in the Lord & Richards family. It's completely free to you. And it starts with a process we call a retirement freedom review, where we sit down at no cost to you and help you determine, are you ready in all the critical areas that are necessary to have freedom of time, freedom of health in retirement? I'm going to encourage you, if you've been listening to us for a long time, now is the time. Met with some delightful people this week, and one of them said, hey, I wish we had come in 10 years earlier. I said, it's never too late. It's never too late, and we want to help you at whatever stage you are in life. It simply starts with a phone call. Just pick up the phone and give us a call at 720-372-0400. Again, that's 720-372-0400. I'd love to chat with you about how you can achieve financial independence from a biblical point of view. Or just check us out on the web at lordandrichards.com. Hi, friends. This is Colin Richards, and welcome back to this episode of the Lord & Richards Show. And today we're talking about the critical retirement freedom we call freedom of health. Yes, you need freedom of time to get away from the job and have income that will supply all of your material needs and allow you to get out and be with those that you love and explore purpose and fulfillment. But if you've got time without health, it's really hard to continue on in those goals, in those dreams, in those visions that you have for that beautiful retirement that you've been thinking about all these years. And when it comes to health, there's essentially three kinds that we need to be prepared for: acute type situations, diseases or injury that are covered by insurance; chronic diseases that are not covered by insurance. That's a big one. That's the number one cause of bankruptcy in retirement. And then I like to focus, when we're healthy, on preventive and proactive care. That is investing in your personal health. And in order to do that, we've got to have the first of the freedoms, freedom of time, which involves abundant income. The abundant income that is designed into your retirement freedom roadmap. This is your plan that's going to get you safely to and through retirement, needs to address not only your ordinary expenses, but also allow you to have enough money to invest proactively in your fitness, in your vitality, delaying the diseases of getting older. It has been shown over and over again that if we will get up and get moving, start to incorporate basic cardiovascular fitness, basic strength training, because this has to do with sarcopenia, the loss of muscle throughout the decades. If we will invest in our strength, we will prolong our life. If we will invest in our cardiovascular fitness, we will prolong our life. And a lot of this type of care or preventive care is free. Right? You can just get out and start moving, or requires minimal equipment. However, if you go a little further down the road into the journey, you may find there's types of equipment that you may need to help you prevent injury. There's certain types of sports that you may want to be involved in, even in older age, that will require some money and some investment, even if it's just getting out and golfing or playing tennis. There's equipment involved in those kinds of things. My family loves to ski, right? That's an expensive sport. But then also pursuing therapies that will help you be more mobile. We have a fantastic friend who is also a physical therapist, also a coach for my daughter with volleyball. And Anthony really helps our family when we have injuries or mobility issues to get up and get moving. But you know what? The labor is worthy of his hire. We're not going to try to soak him and not provide for his needs when we are getting care from him. And so we invest proactively. So investing in your fitness and vitality will help delay the diseases of getting older that are just a natural part of aging. Also, I mentioned this big one, chronic illness. Now, I know that a lot of times we simply just want to ignore that. We want to pretend it's not there because maybe by the time you thought about it, you went out and talked to someone and found out, well, to insure myself against the high costs of chronic illness care is astronomically expensive. It sure is. Now, first of all, it's nowhere near as expensive as actually having a chronic illness. Typical costs are around $140,000 a year right now for skilled nursing, and they're going up exponentially. It was just a couple of years ago that it was a little over $100,000. And so those costs are out of control because our population is aging, living longer. And so it is an extremely high cost. Now you say, well, I'll have care in home. It's cheaper. Well, you got to decide how much burden do you want to put on your loved ones, right? Do you want to take your spouse through that without help? Do you want to take your children or other family or friends through that without help? A lot of times it makes all the difference in the world to have somebody come into the home to provide either non-medical or medical care. And typically that costs about half what full skilled nursing costs, as long as you can maintain it. I know when my mom went through her devastating chronic illness, it was important, that they have access to care at an affordable rate or that was covered. So what's the problem? Well, the problem is that we usually just don't have the funds lying around to support ourselves during that devastating time. Isn't it enough to be with a loved one and focusing all your time and energy? And it's quite a drain, right? It can be emotionally, physically, spiritually draining when you're just giving, and you need help. And a lot of times the help we need requires some funds. That's the obstacle that's in the way of this freedom. And so here's a biblical principle for you. Psalm 71:9, do not cast me off in the time of old age. Do not forsake me when my strength is spent. One of the hallmarks of a great culture, a godly culture, is that we care for our elderly. Did you know that there are cultures that do not honor and care for their elderly? One of the great byproducts of missionaries going into some of these areas is that they transform a culture from a self-centered focus through the message of God's love and grace in the gospel to a culture of others focus, right? So do not cast me off in the time of old age. We need to care for those that are elderly, but a lot of times our resources are limited. And so our strength is drained in doing that. What is the solution? Well, it's fantastic. It's called other people's money, right? I don't want to spend all my money. Now, one of the things that we'll do for you when you come in for your complimentary retirement freedom review is we will test your ability to sustain those costs. And we did this recently for a couple. We do it almost every day. And we tested out in the future. It said, well, what would happen if the husband got sick for 4 years? What would happen if the wife got sick? What would that look like to your portfolio? What would that look like to your lifestyle? And sometimes folks have prepared well enough and accumulated enough that they are in a position to self-fund. A lot of times we're not in that position. But whether you're in a position to pay for it yourself or whether you aren't, it's a lot better to find a way to let somebody else pay for it, somebody else that's ready, willing, and able to pay for it. And I'm going to talk about that in our next segment. But in the meantime, here's what I'd like you to do. I'd like you to reach out to us. I'd like you to come in and visit with me, talk to me. I'll meet with you personally and find out, are you ready? Let's do a retirement freedom review. It's a great conversation. It starts with a cup of coffee and a cookie. And we just go from there. And it's no cost or obligation to you. It just starts with a phone call. Just pick up the phone and give us a call at 720-372-0400. Again, that's 720-372-0400. I'd love to chat with you about how you can achieve financial independence from a biblical point of view. Or just check us out on the web at lordandrichards.com. Hi, friends. This is Colin Richards, and once again, I'm excited to be with you on this episode of the Lord and Richards Show. And we're in the midst of a study on freedom of health, one of the 3 critical freedoms to get retired, stay retired, enjoy what we call a biblically based retirement freedom. And so principles such as not casting off one another in old age are important because it means we're going to care for one another when those devastating chronic illnesses come into our life. The traditional solutions, folks, are just not enough. The obstacle is that we've got no money to pay for these huge potential costs. Now, at Lord & Richards, in your Retirement Freedom Review, we'll test that. You may well be in good shape, but then we still want to figure out, is there a way we could find somebody who's ready, willing, and able to pay for this cost and not have to use the high-cost traditional long-term care insurance? Well, folks try to self-fund, right? And when we test that, we'll discover if you're in a position to do that. But it's extremely expensive. There's a high rate of inflation, so it's really hard to keep up. And we're vulnerable in our early days of life when we maybe haven't accumulated a big enough pot of gold to cover those costs. Traditional long-term care is very expensive. The premiums are often not guaranteed and can go up from year to year. And by the time you really need it, you can no longer afford it. And it's a use it or lose it solution, right? And then we've got some positive solutions. How about an other people's money solution, right? People are always telling me, okay, tell me about that OPM thing. Well, first of all, we've talked about abundant income in other segments. Well, it's possible to use one of the abundant income sources in a way where your income literally doubles during periods of chronic illness, often for up to 5 years. And so if you are rolling along through your retirement years, you're drawing income off of your portfolio from a guaranteed abundant income source, we actually have the ability to help you double that income without having to put any more money of your own into the solution. So you can have a multiplied income for chronic illness and increase it by sometimes up to double for up to 5 years. So that's a really cool solution and worth talking about. And then there's one that I think is one of our most popular OPM solutions. So let's say you have some money come into your family. I had a guy named John, and he got a $275,000 inheritance. And he said, Colin, I want to focus on this area of chronic illness or long-term care. Can we set that aside in a bank account so that it's ready? And I said, well, sure, that'll be helpful in today's dollars. That's a couple of years, but we really want that to grow, right? Because the costs are going up exponentially every year. He said, okay, how about the market? And I said, well, that's a risk solution, not usually where we want to put money that we need to have at a certain time, such as when we get sick. And he says, well, what do you recommend? And I said, well, here's a cool one. How about we put the $275 into this other solution? It's immediately worth $922,704 for chronic illness care. He's like, I like that. And I said, yeah, and it's not use it or lose it, because if you never end up needing it, it can go to your family. And by the way, it's all tax-free, the difference between the $275 and the $922. And he said, so the $275 goes to my family? I said, no, the $922. And he said, well, what is that? And I said, John, it's actually a form of life insurance. It's called a hybrid life insurance benefit, or what we call living benefits. You've heard of death benefits, right? That's why we don't really want life insurance, because we don't benefit. We have to die. Well, here you're still alive, and your loved ones or spouse can draw not the money you put in, but the multiplied living benefit. In John's case, almost $1 million. And he said, absolutely, that's what we're going to do. And he said, well, tell me a little bit more about it. I said, well, it's principal protected, so it's never going to go down, your original $275 or the $922 that's going to be left to the family. And by the way, if you need to get access to that $275 later in life, you can. You can put it in all at once, say like you got inheritance, you had to sell a deceased family member's home, or you can put it in gradually over time if it's more something where you want to just make contributions to this plan. And it grows tax-free. It grows tax-free. So whatever we use it for, whether it's for chronic illness or to pass it on to our family, it's worth it because it's tax-free. When you take money out of your IRA, what happens if you pay bills with that? Well, you're going to get taxed. So here's the conclusion. You need a living benefits specialist, somebody who knows how to use other people's money to solve these big medical problems that bankrupt so many people. Number one cause of bankruptcy in retirement. You need somebody who knows how to navigate that for you. And guess what? At Lord & Richards, we step into that gap for you as well. We are a specialist in helping you avoid the risk of unexpected healthcare costs and helping you achieve freedom of health in retirement. That's exciting. So freedom of time, abundant income is the solution. The obstacle is having to go to your job. Freedom of health, living benefits or other people's money is the solution to the high costs of chronic illness care that so often bankrupt us. And this is all just a small part of everything that we do free of charge for our clients to help you get prepared for retirement or remain on solid ground through the rest of your retirement years so you can do the things that you love with the people that you love. And the process is called a retirement freedom review. We sit down together, you share with us your goals, your dreams, your values, what's important to you, and then we just start removing the obstacles that get in the way of your success. That's what we do at Lord & Richards, until finally what remains is a beautiful picture of a retirement that brings happiness, joy, and fulfillment. I can't wait to talk to you about this. I'm talking to people just like you every single day. I want you to reach out to us. It simply starts with a phone call. Just pick up the phone and give us a call at 720-372-0400. Again, that's 720-372-0400. I'd love to chat with you about how you can achieve financial independence from a biblical point of view. Or just check us out on the web at lordandrichards.com.
Investment advisory services offered through Lord & Richards Wealth Management, LLC.